Listen to me very carefully. Because what I'm about to tell you will either save someone's life or destroy it forever. Right now, as you're watching this video, someone you love is 90 seconds away from having a stroke. Maybe it's your mother making dinner, your husband driving home from work, your best friend exercising at the gym. And when it happens, not if, when, you're going to make a choice that determines whether they live, or spend the rest of their life wishing they had died. I know this because I watch it happen every single day. My name is Dr. Chen. For the past 25 years, I've been fighting a war against time in emergency rooms across America. I've held the hands of thousands of stroke victims. I've delivered the news that changes families forever. And I've discovered something that will terrify you. 87% of stroke victims receive the wrong first aid from the people who love them most. Let me tell you about Emma Rodriguez. Last Tuesday, she watched her grandfather have a stroke during her school play. While the adults panicked, little Emma remembered what she learned in her first aid class. She didn't give him water. She didn't move him. She didn't try to make him comfortable. She simply called 911 and followed my protocol exactly. Her grandfather walked out of the hospital 3 days later with 0 permanent damage. Now let me tell you about Dr. Michael Harrison, emergency room physician with 15 years of experience. Last month, his wife had a stroke in their kitchen. This man saves lives for a living. But when it was his wife, his emergency, his moment of terror, he made every single deadly mistake. I'm about to show you. His wife spent 6 weeks in intensive care and will never walk again. A 9-year-old girl saved her grandfather's life. A trained doctor destroyed his wife's future. The difference: knowledge. The right knowledge. The kind that separates heroes from killers in the most critical moments of human existence. Here's what I want you to understand right now. When your brain is screaming do something, help them, your instincts will try to murder the person you're trying to save. And here's the terrifying truth that keeps me awake at night: the human brain, in moments of extreme panic, reverts to the most primitive survival responses: fight, flight, or, unfortunately, help. That help response, it's hardwired into us from millions of years of evolution. But evolution never prepared us for strokes. Last month, I had to tell Jennifer Martinez that her husband Carlos was brain dead. Carlos Martinez, 34 years old, father of twin girls. He collapsed during his daughter's birthday party. You know what killed him? It wasn't the stroke. It was the birthday cake. Carlos is on the living room floor. 40 guests staring in horror. Jennifer's sister shouts, "Give him some cake. Sugar will help." They prop up his head. They're shoving chocolate cake into his mouth, thinking they're saving his life. They were drowning him from the inside. When someone has a stroke, their throat muscles stop working. It's like their swallowing switch gets turned off. That cake went straight into his lungs. By the time the ambulance arrived, his lungs were full of chocolate and frosting. The aspiration pneumonia was so severe that even when we stopped the stroke, his body couldn't recover. I had to explain to Jennifer that her husband died because people who loved him tried to feed him birthday cake during the worst moment of his life. But here's what makes this even more heartbreaking. Carlos survived the initial stroke. His brain damage was minimal. If they had simply left him alone and called 911 immediately, he would be playing soccer with his daughters right now. Instead, Jennifer is a widow at 32. And 2 little girls will never remember their father's voice. But that's just mistake number 1. The others are worse. Picture this. Your loved one collapses. They're conscious, but something is terribly wrong. Their speech is slurred. Their face is twisted. They can't move their arm. What's your first instinct? I need to get them comfortable. I need to move them to the couch. Stop. Right. There. That instinct just turned you into an accessory to attempted murder. When you're having a stroke, your brain is like a water balloon with a tiny hole in it. Every movement, every jolt, every bounce makes that hole bigger. The brain tissue that could have been saved gets destroyed. The damage that might have been reversible becomes permanent. I've seen patients go from minor strokes to complete paralysis because families tried to make them comfortable. The cruel irony. The person having the stroke isn't uncomfortable from lying on the floor. They're barely aware of their surroundings. But that movement you think is helping them. It's destroying their future one brain cell at a time. Think about it this way. If you found someone with a broken spine, would you pick them up and carry them to bed? Of course not. But somehow, we think a broken brain is different. It's not. It's more fragile than any bone in your body. Mistake number 3 is the one that makes me lose sleep at night. You've heard it 1,000 times. If someone's having a heart attack or stroke, give them aspirin. Wrong. It's common ignorance. And it's killing people. Here's what they don't tell you in those first aid classes. There are completely different types of strokes. 87% are ischemic strokes, caused by blood clots blocking arteries to the brain. But 13% are hemorrhagic strokes, caused by bleeding in the brain. 13% doesn't sound like much. Right. That's 1 in every 8 stroke patients. Would you play Russian roulette with 8 chambers if one was loaded? Because that's exactly what you're doing when you give aspirin to a stroke victim. That aspirin you think will save them. If they're having a bleeding stroke, it makes them bleed more. I've watched small bleeds turn into massive hemorrhages because families gave life-saving aspirin. The blood thinner that was supposed to dissolve a clot instead turned their brain into a crime scene. And here's the cruel joke. You can't tell the difference between the 2 types just by looking. Even WE can't tell in the emergency room without a CT scan. So when you give that aspirin, you're literally gambling with their life. Here's the mistake that absolutely destroys me. Delay. Maybe it'll pass. They're tough. They'll shake it off. Let's see how they feel in an hour. While you're having this conversation. While you're convincing yourself everything will be fine. Their brain is being butchered by lack of oxygen. Every minute you delay, more of them dies. Million brain cells every single minute. Let me put that in perspective for you. In the time it takes to watch a typical YouTube video, about 10 minutes, 20 million brain cells have died. That's enough to control speech, memory, personality, movement. The person you're trying to save, they're literally disappearing while you watch. I've seen families wait over an hour, thinking their loved one just needs rest. They make excuses. He's been working too hard. She's just tired. Maybe it's the medication. Meanwhile, the clock is ticking like a bomb. And every second of delay is stealing pieces of the person they love. The most tragic part. Most families wait because they're in denial. They can't accept that this is really happening. Not to us. Not today. Not like this. But strokes don't care about your plans. They don't care that you have a wedding next week or a vacation booked. They happen when they happen. And denial kills. Love makes us stupid. Panic makes us dangerous. When someone we care about is dying, our instincts turn us into killers. But here's the truth that's going to save someone's life today. When you see the signs of a stroke, you have minutes to act. Not hours. Not let's wait and see. Minutes. And what you do in those minutes will determine whether your loved one comes home from the hospital, or whether you're picking out a nursing home. The medical term is time is brain. Every minute that passes, more brain tissue dies. But here's what we've learned in the last decade. If you get stroke treatment within the first hour, 90% of patients make a complete recovery. 90%. But wait just 3 hours. That drops to 30%. Wait 6 hours, less than 10% will ever be the same again. I'm going to teach you something right now that every single person on this planet should know. It's called F.A.S.T. And it's literally the difference between saving a life and destroying one. F is for face. Look at their face. Ask them to smile. Does one side droop like it's melting? Can they control both sides of their mouth? If their smile looks lopsided, if half their face isn't working, that's your first warning sign. This happens because the stroke is affecting the nerves that control facial muscles. A is for arms. Tell them to raise both arms above their head. Can they do it? Does one arm drift down like it's too heavy to hold up? If they can't keep both arms raised, you're looking at a stroke. The weakness is usually on one side of the body because strokes typically affect one hemisphere of the brain. S is for speech. Ask them to repeat something simple. The sky is blue today. Listen carefully. Are the words slurred? Do they sound drunk? Are they using the wrong words entirely? Sometimes they'll say blue when they mean green. Or they'll call a car a house. If their speech is off, that's your third confirmation. T is for time. If you see any of these signs, even just one, you call 911 immediately. Not in 5 minutes. Not after you try something else. Now. And here's the critical part. Write down the exact time you first noticed symptoms. The hospital needs to know this to determine which treatments are still possible. But knowing F.A.S.T. is only the beginning. Because what you do while waiting for the ambulance, that's where lives are won or lost. The first thing you need to understand is that the moment you recognize a stroke, you become their lifeline. Not the paramedics who are still driving to your location. Not the doctors who haven't seen them yet. You. And what you do in the next few minutes will determine whether they live independently or spend their remaining years in a wheelchair. Here's the protocol that saved thousands of lives. And I'm going to walk you through it step by step. After you've called 911 and identified the stroke using F.A.S.T., your only job is to keep them stable and safe until help arrives. That means following what I call the do-nothing protocol. And I know that sounds wrong. Every instinct in your body is screaming at you to do something. But sometimes, the most heroic thing you can do is absolutely nothing. First, leave them exactly where they are. If they collapsed on the kitchen floor, that's where they stay. If they're slumped in a chair, don't move them. If they're lying awkwardly on the stairs, I know it looks uncomfortable, but that awkward position might be the only thing keeping blood flowing to their brain. Here's what you can do safely. Look around for any immediate dangers. Is there a gas stove still burning? Turn it off. Are they near a busy street? You can gently guide people away. But don't move the stroke victim. Are they in a pool? Obviously. You need to get them out. But do it by supporting their head and neck. Moving them as little as possible. Second, loosen any tight clothing around their neck and chest. Tees. Tight collars. Bras. Belts. Anything that might restrict breathing. But don't undress them completely. They're already vulnerable and scared. Maintain their dignity while ensuring they can breathe freely. Third, if they're conscious, talk to them. Keep them calm. I don't care if they can't respond properly, they can still hear you. Tell them help is coming. Tell them they're going to be okay. Tell them you're staying right there with them. Your voice might be the only thing anchoring them to consciousness. But here's the critical part. If they start vomiting, you must turn their head to the side. This is the one time you're allowed to move them. Stroke victims often vomit. And if they're lying on their back, they can choke on their own vomit. Turn their entire body as one unit, head, shoulders, torso together. Don't just twist their neck. Now, while you're waiting, there's something else you need to do that could save their life. Be their medical detective. The paramedics are going to ask you questions, and your answers will determine how they're treated. Write down the exact time symptoms started. What were they doing when it happened? Were they eating, exercising, sleeping, arguing? What medications do they take? Do they have high blood pressure, diabetes, heart problems? I remember a case where a woman told us her husband had been acting strange for about an hour. But when we pressed her for details, she remembered he'd complained of a sudden, severe headache 3 hours earlier. That 3-hour difference changed everything. It meant he was no longer eligible for the clot-busting drugs that could have saved his speech and movement. Every detail matters. You're not just a bystander, you're gathering evidence that could save their life. But here's what I really want to talk about. Because this is where we move from emergency response to something much more powerful. Prevention. The truth is, most strokes don't just happen. They're the culmination of years, sometimes decades, of warning signs that we either ignored or didn't recognize. And here's the incredible news. If you understand these warning signs, you can prevent 80% of strokes from ever happening. Let me tell you about Patricia Williams, 62 years old, grandmother of 4. 2 years ago, Patricia started having what she called mini episodes. She'd get dizzy standing up. Sometimes she'd forget common words mid-sentence. Her vision would blur for minutes, then clear up. Patricia did what most people do. She ignored it. I'm just getting older, she told herself. Those weren't senior moments. They were transient ischemic attacks. TI. Mini strokes. Her brain was sending SOS signals, begging her to pay attention. Last month, I watched Patricia's family make the decision to stop life support. The woman who once tended prize-winning roses now lay in a coma. Her brain so damaged she couldn't breathe on her own. Her 4-year-old granddaughter kept asking, why won't Grandma wake up, while her daughter held Patricia's cold, lifeless hand. All because Patricia ignored 2 years of warning signs. But let me tell you about Robert Chen, no relation, despite the name. 74 years old, retired teacher. Last year, Robert started having similar episodes. Dizziness, word-finding problems, brief vision changes. But Robert's daughter is a nurse. She recognized the signs. Within a week, Robert was on blood pressure medication. He changed his diet, started walking 30 minutes daily, and began taking a low-dose aspirin under medical supervision. 6 months later, his arteries had actually improved. The plaque that was building up started dissolving. His risk factors normalized. Robert just celebrated his 75th birthday by hiking 5 miles with his grandchildren. Same symptoms as Patricia. Completely different outcome. The difference: recognition and action. Here's what most doctors won't tell you, and what I've learned from 25 years of watching people die from preventable strokes. Your body gives you a 10-year warning before most strokes happen. 10 years. That's not a medical guess, that's what the research shows. The high blood pressure. The cholesterol buildup. The blood sugar spikes. They don't happen overnight. They're a slow-motion catastrophe that you can stop at any point. The most powerful stroke prevention tool isn't some expensive medical device. It's a $20 blood pressure cuff from any pharmacy. High blood pressure is the #1 cause of strokes. But here's the secret that pharmaceutical companies don't want you to know. In 70% of cases, you can normalize your blood pressure without a single medication. I've seen patients drop their blood pressure from 180/110ths to 125/80ths in just 3 months. How they cut their sodium intake in half. Walked 30 minutes daily. Lost 15 pounds. And learned to manage stress. Their stroke risk dropped by 85%. Your blood pressure should be below 120/80ths. If it's higher, you're not just at risk, you're actively damaging your brain every heartbeat. Here's the second secret. Cholesterol isn't just about what you eat. It's about inflammation. When your arteries are inflamed, cholesterol sticks to the walls like mud on a dirty car. But when inflammation goes down, cholesterol flows right past. The most powerful anti-inflammatory exercise. 30 minutes of walking reduces arterial inflammation more than most medications. I've watched patients with cholesterol over 300 drop to normal levels without changing their diet, just by moving their bodies every day. Your total cholesterol should be below 200 LDL, below 100. But more importantly, your HDL, the good cholesterol, should be above 40 for men. Above 50 for women. HDL is like a garbage truck, cleaning cholesterol out of your arteries. The third factor is blood sugar. Even if you're not diabetic, blood sugar spikes damage your blood vessels. Every time you eat a high-sugar meal, you're essentially sandblasting the inside of your arteries. But here's what amazed me. I had a patient, Maria Santos, 68 years old, pre-diabetic with an A1C of 6. Instead of starting medication, she tried something radical. She ate the same foods, but changed when she ate them. No breakfast. Normal lunch. Light dinner. Intermittent fasting. Within 4 months, her A1C dropped to 5.4, completely normal. Her inflammation markers plummeted. Her stroke risk went from high to virtually 0. Every cigarette damages your blood vessels. If you smoke, you're 3 times more likely to have a stroke. But here's the miracle. If you quit today, within 2 years, your stroke risk returns to that of someone who never smoked. Your body can heal that fast. Exercise is literally medicine for your brain. When you exercise, you grow new blood vessels, what we call collateral circulation. If one artery gets blocked, these backup routes can save your life. I've seen stroke patients with massive clots who had minimal damage because they had decades of exercise-created backup arteries. You don't need marathons. 30 minutes of walking, 5 days a week, reduces stroke risk by 30%. That's more effective than most medications. Here's something that will shock you. Chronic stress kills more people than smoking. When you're constantly stressed, your body produces cortisol and adrenaline that literally poison your blood vessels. Stress hormones make your blood thick and sticky, raise your blood pressure, and trigger dangerous heart rhythms. I've seen people have strokes during arguments, after job loss, during divorce proceedings. The mind-body connection isn't philosophical, it's lethal. Learning to manage stress through meditation, prayer, therapy, or simply laughing with friends isn't just good for your mood. It's life insurance for your brain. Sleep is when your brain cleans itself. During deep sleep, Your brain literally washes away the toxic proteins that cause strokes and dementia. If you're not getting 7 to 8 hours of quality sleep, you're poisoning your brain. Sleep apnea doubles your stroke risk. But treating it with a simple CPAP machine brings that risk back to normal. Every one of these factors is within your control. You don't need expensive treatments. You need knowledge, commitment, and the understanding that small changes create miraculous results. The stroke that could devastate your family next year can be prevented by choices you make this week. The independence you'll have in your 80s is being determined by what you do today. I want you to make me 3 promises right now. Promise me you'll get your blood pressure checked this week. Promise me you'll ask your doctor about your cholesterol and blood sugar levels. Promise me that if you smoke, you'll make a plan to quit. But most importantly, promise me you'll share this knowledge. The person watching this might not be the one who needs it most. It might be your spouse walking around with dangerously high blood pressure. Your parent ignoring TIA warning signs. Your friend who's stressed and exhausted. The 5 minutes you spend sharing this video could save someone's life. The conversation you have about stroke prevention could prevent a tragedy. If you ever find yourself in that terrifying moment when someone you love is having a stroke, you now have the knowledge to be their hero. You know to call 911 immediately. You know F.A.S.T. You know to keep them still while help comes. You know the difference between helping and harming. And that knowledge could be the most important thing you ever learn. Remember, when it comes to strokes, every second counts. Every decision matters. And every person you share this knowledge with could be a life saved.